Good day, students. Welcome to GAME, Gross and Microscopy Explained. The topic for the day is a little complex, but still we shall understand it. On either side, I am having a gross and the microscopic picture of the lesion. Benign prostatic hyperplasia, also called as nodular hyperplasia. The theory part of it we shall be seeing elsewhere in R.A.T.S. And this is the significance of it. This is the source of this particular picture over here, and what I am seeing is an enlarged prostate that is compressing the urethra. And we shall also be seeing a hypertrophy of the bladder owing to retained pressure. The urethra is reduced to a slit-like space. Sometimes there can be a pedunculated ball valve-like obstruction because the prostatic parenchyma can come into the urethral space. Generally, it is yellowish pink in color, indicating the stroma and the glands. And look at this particular picture, it is bulging above the cut surface, which is classical of any parenchymal enlargement. The gross picture. This is usually not kept for the undergraduates, but it pays dividend for us to complete. You find that the inner and the periurethral part, this is the urethra, and then this is the periurethral region of the prostate will be affected. It is not capsulated, but there can be a condensation producing a pseudocapsule-like appearance. The weight can be up to 100 grams, 60 to 100 grams, or even up to 200 grams. Normally it is about 20 grams. There is a plane of cleavage between the central and the peripheral zones. Prostatic parenchyma is nodular and the glandular component is pale pink. So it is pale pink over here, whereas the stromal component will be grayish. So this is a university exam slide for you people. As I told you, the theory part of it we shall be seeing elsewhere. Now there is a hyperplasia which is showing the glands which are racemose in outline. Racemose is the outline. This is a section of the prostate. I am finding the glandular elements over here, and this spindle shaped elements are the stromal elements. So there is a hyperplasia of the glands as well as the stroma. Also, I find within the glands and the ducts, there can be some inspissated secretions called as corpora amylaceae. The glands itself, you find that they are not round in outline, but they are somewhat irregular, and this is called a racemose or a leaf-like pattern. Look at this particular gland. You find that the outline is irregular, and this is called racemose or leaf-like. Normally in a prostate, there will be two layers. One will be an inner epithelium, the other is the basal layer. And the basement membrane is intact. This is called as a holy leaf-like pattern, the racemose pattern. This again is the same. I am finding multiple racemose glands. The glands have an infolded epithelium. There are two layers over here, and the foldings produce a holy leaf-like pattern. The stroma is fibromuscular. Inflammation might be present. Metaplasia might be present. And there can be corpora amylaceae. So this is a slide for you people. I would like you to kindly remember and reproduce this. See you in game 29.